Ontario Premier Doug Ford and two members of his cabinet have been tested for COVID-19. The Education Minister, Stephen Lecce, was first to be tested. He says he came into contact with someone who had the virus. Lecce says his test has come back negative. Out of an abundance of caution, Premier Ford and Health Minister Christine Elliott also got tested. They're still waiting for their results and didn't appear at the media briefing today. Ford's nephew, Toronto City Councillor Michael Ford, has revealed he's tested positive for COVID-19. The Premier's office says the two have not come into contact with each other in the past 14 days. A negative test does not guarantee you aren't infected with the virus. A lot depends on when exactly you were tested. Doing it too soon can give a false negative. And as Abigail Bimman explains, that has big implications as we open up the economy.
A disinfectant plus sanitizer is what we're using now.
Some Ontario restaurants are preparing to reopen patios Friday. With that, as owner Ivan Geddes knows, comes an increased risk of transmission.
I've had to ask people to leave sometimes because they've overconsumed. It's going to be the same sort of jam. If somebody's not taking that seriously, they're not abiding by those sort of things, they got to leave because the health and safety of our staff is incredibly important.
And new research out of John Hopkins University suggests more people could be walking around sick than we think, showing the main type of coronavirus testing produces at least 1 in 5 false negatives. On infection day 1, a test is completely ineffective. By day 5, when symptoms typically start, the false negative rate hits 38%. That drops to 20% by day 8 before climbing back up.
You have someone where you really think they have a high probability of being infected, you shouldn't just kind of rest easy once you have the negative test results.
Having these kind of results suggest that, we are definitely missing part of the picture.
Virologist Benoit Barbeau says so much is still unknown about COVID-19, and there are so many variables. Until we can find a better standardized test, people should get tested more than once. Coupled with false negatives, the mystery of asymptomatic transmission. The World Health Organization forced to walk back comments that asymptomatic people posed little to no risk, now saying the science isn't settled.
They're out there for sure. We cannot detect them. They don't know that they're infected. They might represent an important element in the spreading of the virus.
Keep all this in mind as provinces take more reopening steps, but Barbeau says it shouldn't stop people from living more normal lives. Geddes isn't worried about people staying home out of fear.
We have no doubt we'll be full. It's about managing those people.
He's more worried about people not taking the pandemic seriously enough. Abigail Bimman, Global News, Ottawa.
Some good news for families whose loved ones live in long-term care homes in Nova Scotia. As of June 15th, visitors will be allowed again. The visits must take place outside, though. Visitors will be screened, people must keep 2 meters apart, and non-medical masks must be worn. The Premier says it's a start.
Now, I know this is not exactly what you were hoping for, and we understand your craving for that long-awaited hug. We're not there yet, but sitting in the fresh air and a visit with your loved one is a good first step.
Nova Scotia reported no new cases of COVID-19 today and only 5 active cases of the virus.